know if TPN, when the patient is on BiPAP in ICU, is appropriate, stay tuned. I've got news for you. My name is Patrick Hutzel from IntensiveCareHotline.com with another quick tip for families in intensive care. So currently we are working with a client who have their 90-year-old dad in ICU on BiPAP. And they're up to 70 and sometimes up to 100% of FiO2 with an IPAP of 8 and an EPAP of 18. And the tidal volumes are good, but the blood gases are reasonably poor. And, currently the intensive care team is struggling in keeping the patient off intubation, but that is absolutely the goal. Now, the issue is that the patient hasn't had any nutrition for many days because of the BiPAP. They couldn't really get any nasogastric tube feeds because of the risk of aspiration with all the pressures going into the stomach. So now the question is, what is the next step in terms of nutrition? I mean, research and evidence base is that you need to feed a patient in intensive care when they're critically ill in order to deal with a critical illness. They need nutrition, they need proteins, carbohydrates, sugars, and all the rest of it. So the question is what to do next. There's two options here, right? One option is TPN, which means the patient would need a central line or a PICC line, right? Or a jejunostomy tube, right? A jejunostomy tube, either a nasal jejunostomy tube or a percutaneous endoscopic jejunostomy tube. We recommend either an NJ tube, a nasal jejunostomy tube, or TPN, right? Bottom line is that the patient needs nutrition. And it takes some advocacy, to get this over the line, because the intensive care team says, well, if you start using TPN, for example, right, it is a big infection risk. And whilst I agree there's an infection risk, but to a degree, that's like saying we stop eating and drinking because food might be contaminated, right? We have to eat and drink regardless of the low risk that is included when you eat and drink, that food or drinks might be contaminated, right? So don't let intensive care teams dissuade you from TPN in particular, but nasal jejunostomy tube is definitely also an option and should be discussed here as well. But the bottom line is that the patient needs feeding, and the patient needs nutrition in order to deal with this critical illness. So that is my quick tip for today. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in ICU, and I've been consulting and advocating for families in intensive care since 2013 here at IntensiveCareHotline.com. And I can very confidently say that we have saved many lives with our consulting and advocacy, and you can verify that on our testimonial section. And you can also verify it on our podcast section, both at IntensiveCareHotline.com. We have helped hundreds of clients and members over the years to improve their lives instantly when they have a loved one critically ill in intensive care by getting real results, by applying our proven strategies to get results for families in intensive care. And that's why we created a membership for families of critically ill patients in intensive care. And you can become a member if you go to IntensiveCareHotline.com, if you click on the link, or if you click on the link on our website, IntensiveCareHotline.com, if you click on the membership link, or if you go to IntensiveCareSupport.org directly. In the membership, you have access to me and my team 24 hours in a membership area, and in the and via email. And in the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded, helping you to make informed decisions, have peace of mind, control, power, and influence, so that your loved one gets best care and treatment always. I also do one-on-one consulting and advocacy over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply can't afford to get wrong. I also talk to doctors and nurses directly, and when I talk to them directly, I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that you get at IntensiveCareHotline.com. call us on one of the numbers on the top of our website, or simply send us an email to support@intensivcarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next or what questions and insights you have from this video. I also do a weekly YouTube Live where I answer your questions live on a show, and you will get notification for the YouTube Live if you are a subscriber to my YouTube channel, or if you are a subscriber to my email newsletter at intensivcarehotline.com. Thank you so much for watching. This is Patrick Hutzel from intensivcarehotline.com, and I will talk to you in a few days. Take care for now.